Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the histology of the uterine tube. The uterine tube extends from the ovaries to the uterus. This is the ovary, and uterine tube extends from the ovary to the uterus. It has four parts. The infundibulum. The infundibulum is here, then the ampulla, then then we have the isthmus and the intrauterine part. The uterine tube undergoes changes during menstrual cycle, and ampulla, this is the dilated part. Ampulla, this is the site of fertilization. And once it is fertilized here, it takes for around 4 to 5 days for the fertilized product to go from the product of from the site of fertilization to the uterus. Okay, so if you go to the histology of the uterine tube has multiple name. It is also called oviduct. It is also called salpinx. So the uterine tube, what are the identifying point? We have the mucosa. This is the mucosa, and that is lined by simple columnar epithelium. Okay, we'll go there. The mucosa. Okay, so this is the mucosal lining here. This is mucosa lining. These are the columnar epithelium, and in between columnar epithelium we'll also get the non-ciliated columnar cell. So these columnar cells are ciliated. Among the ciliated cell, we'll get non-ciliated PEG cell. They are secretory in function. So mucosa lined by simple columnar epithelium. These are the columnar epithelium, like a column with the cilia. We have ciliated cell and the PEG cell. PEG cell is non-ciliated. We have smooth muscle here, and we have the outer longitudinal muscle and inner circular muscle. So outer longitudinal muscle and inner circular muscle that encircle the fallopian tube. Serosa is present here. This is serosa. This is the loose connective tissue, and it contains a lot of blood vessels, and it is lined by the mesothelium, the visceral peritoneum. So we got the lining, tall columnar epithelium with cilia. Some of the cell has no cilia. Those are called PEG cell. And we have the lining epithelium supported by the lamina propria. That is also a loose connective tissue. And it is vascular, and it also contains lymphatics and nerves. Then we'll get the muscular layer. These are the circular muscle layer supported by the longitudinal muscle layer. Okay, we got the parts of the uterine tube, also called oviduct, also called salpinx, also called fallopian tube. Okay, here is the lining epithelium. These are tall columnar epithelium with cilia. We got cilia and tall columnar epithelium supported by the lamina propria cells. There is a loose connective tissue rich in blood and lymphatics and nerves. Some of the cell in the lining of the fallopian tube are non-ciliated with bulging upper apical surface. Upper surface is bulging, and they have no cilia. They are mainly secretory in function. They secrete for nutrition of the ovum and the spermatozoa, and they are called the PEG cells. Okay, so we have found that folded mucosa, again lined by the simple columnar epithelium. Epithelium is supported by the lamina propria. Then we'll get the circular muscle layer. Then we'll get the longitudinal muscle layer. Then we get the serosa, that is lined by simple squamous epithelium. Again, the mucosa is very much folded, and folding is very much common, especially in case of ampulla of the fallopian tube. If you look at the isthmus, then the folding is comparatively less. In the intramural or intrauterine part of the fallopian tube, the folding is even less than that. So it is mostly in the ampulla, we'll see this labyrinthine appearance. This will be decreased in the isthmus as well as in the intramural part or intrauterine part of the fallopian tube. Okay, so what are the functions of the fallopian tube? Collect the ovum from the ovary after fertilization. Ampulla is the site of fertilization. Provide nutrition and support to the ovum and the spermatozoa. The PEG cell contains glycoprotein. It secretes and provides nutrition, helps in the capacitation of the spermatozoa. So spermatozoa can penetrate the corona radiata, can enter into the developing ovum. Act as a conduit for the ovum. The zygote, the product of fertilization, okay, containing 46 chromosome and morula, mulberry shape. The fertilized product will start going through series of mitotic division from the ovary to the uterus. It may take around 4 to 5 days from the ampulla to the uterus. Okay, so it collects the ovum from the ovary after fertilization. Idea is that so that the ovum should not fall into the peritoneal cavity. Ovum should be inside the fallopian tube or uterine tube or oviduct. Okay, clinical application: ectopic pregnancy. Pregnancy site of implantation should be in the body of the uterus, close to the fundus. If it is outside that, we call it ectopic pregnancy. Fallopian tube or uterine tube is a site of ectopic pregnancy. This is a site of ectopic pregnancy, and idea is that once the fertilized product implant in the lumina of the in the mucosa of the fallopian tube, the space is minimum, so the developing embryo will actually rupture the fallopian tube, lead to acute abdomen, may lead to bleeding. It is an emergency in ectopic pregnancy. It should be managed in the emergency department. Salpingitis, that is inflammation of the salpinges. Salpinges are another name for the uterine tubes. Okay, so salpingitis is a part of pelvic inflammatory disease, may be caused by sexually transmitted disease like that of gonorrhea or chlamydia. Blockage of the uterine tube, that may be a part of the pelvic inflammatory disease, salpingitis. So the passage is inflamed and blocked. There may be scar tissue formation that will lead to sterility. Tubectomy is a permanent sterilization procedure practiced in many parts of the world. Idea to take a part of the fallopian tube so that that lady cannot be pregnant. Okay, we got that. Now here's some Viva question. What are the identifying point? We have very simple: mucosa, muscular layer, and the serosa. Mucosa is lined by the tall columnar ciliated epithelium. We have some non-ciliated PEG cell in between the ciliated cell. Okay, so we have the lining epithelium like that. Two type of cell. One is ciliated cell and that is non-ciliated cell. Ciliated cell actually sweep the ovum towards the uterus. Okay, so it has some function in that way. And once there is fertilization and cell division started, then the ciliary movement also help to put the product of fertilization to the uterus. Okay. Also, the passage of the ovum from the ovary to the fallopian tube is also controlled by the smooth muscle in the wall of the fallopian tube. It is found that in immotile cilia syndrome, despite the loss of cilia, the fertilization is possible. Okay. What are the parts of uterine tube? We have four parts. One is the infundibulum, the fimbriated end part, just over the ovary or close to ovary. Then the ampulla, the major part of the uterine tube. Then the isthmus, the narrow part. Then the intramural part. Okay. Functions of the oviduct or uterine tube, same thing, or sulpings. Okay. Oviduct, it actually carries the ovum from the ovary to the ampulla. Then if the ovum is fertilized, then what will happen? The product of fertilization will go to the uterus. Okay. So this is a site of fertilization, and at this site, the first meiotic division is ended. It is started in the second meiotic division in the ovum. Once it is fertilized, then the second meiotic division will be completed in the ovum. How about the lamina propria and serosa? These are loose irregular connective tissue, and they are rich in blood vessels and lymphatics. Serosa is also lined by the mesothelium or the visceral peritoneum. There is a simple squamous epithelium. How is the muscle are arranged? Muscles are smooth muscle, and we have the inner circular muscle layer, outer longitudinal muscle layer. What are the functions of pec cell? To secrete and provide nutrition in the form of glycoprotein in the uterine tube. What is ectopic pregnancy? Any pregnancy that is not in normal site. Normal site is in the body of the uterus, close to the fundus. If anything outside that, that is the ectopic pregnancy. How the mucosa is folded? The mucosa is very much folded in the ampulla. It folding is decreased in the isthmus and further decreased in the intrauterine or intramural part of the uterus. What is the site of fertilization? That is the ampulla. And that's all about the histology of the fallopian tube or uterine tube or oviduct. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice day. Bye now.